Recently, the Biden administration announced they want to crack down on big insurance companies and Medicare Advantage from taking advantage of taxpayers and American seniors. See, this sounds good, because it is, but it doesn't address the real problem. The real problem is the privatization of Medicare, traditional Medicare. We've taken guaranteed health coverage in traditional Medicare and turned it into corporate managed care where literally they make as much money as possible by spending as little as possible on healthcare. In traditional Medicare, seniors can have choice to see almost any doctor they want without fear of being denied coverage. But there are gaps in traditional Medicare because healthcare has evolved and it's become a lot more expensive. Corporations, lobbyists, and their pet politicians have intentionally sabotaged the process, stopping Congress from actually strengthening Medicare and filling in those gaps. For example, the Centers for Medicare and Medicaid Services have required Medicare Advantage plans have an out-of-pocket limit on how much their users can spend. But there's no such thing created for traditional Medicare users. This is a policy choice, not a natural outcome. So now traditional Medicare users have to buy a supplemental Medigap plan, which can cost hundreds of dollars a month, to fill in those cost gaps. Instead of Congress investing Medicare dollars into strengthening traditional Medicare, they're funneling all this taxpayer money into big insurance giants behind Medicare Advantage. Now, Medicare Advantage can sound appealing, but in reality, it doesn't stack up to traditional Medicare when it comes to providing reliable coverage for the necessary care that people need, regardless of how serious it is. If you don't get sick or don't get particularly injured, Medicare Advantage can seem great. It's cheap, low premiums, and you might not care that there's restricted networks and denials of coverage. And by restricting coverage and taking in all this taxpayer money, they can promise things like supplemental benefits, vision, dental, and hearing care that traditional Medicare does not currently offer. But remember, this is not a level playing field. By not addressing this, the Biden administration is reinforcing a false choice in competition between traditional Medicare and Medicare Advantage. We should not accept a framework created by the insurance companies, their lobbyists, and their paid-for politicians. Taxpayers overpaid Medicare Advantage plans by between $80 and $144 billion in 2022 alone. Those overpayments could have strengthened traditional Medicare and provided a $5,000 out-of-pocket cap and provided vision, dental, and hearing coverage. So all in all, thank you, President Biden, for attempting to rein in big insurers and stop them from outright robbing us. But you need to give the American people a real choice by making Medicare what it's supposed to be and stopping its privatization.